In our previous video, you learned about whether you are going to be covered by group insurance or not when you become eligible for Medicare. If you're not going to be covered by group insurance, then you're in the right place, because the next step for you in turning 65 is to decide whether you want to be covered by original Medicare or an alternative to original Medicare called Medicare Advantage. In the next couple of minutes, I'll explain the main differences between the two, so let's get started. You may have recalled this slide from our last video. We discussed parts A, B, and D, and now it's time to talk about part C. Medicare Advantage is a partnership between private insurance carriers and the Medicare program. You will choose to receive your Medicare benefits from original Medicare, as we discussed in the previous video, or from a private insurance company that has to follow certain rules in delivering your Medicare Advantage benefits to you. This is called Medicare Advantage. So why do people choose Medicare Advantage? Well, oftentimes it's because the plans offer inducements like small monthly premiums, including zero premiums. And as you can imagine, that gets a lot of people to consider Medicare Advantage. Additionally, they might offer extra benefits like vision, hearing, and dental benefits, as well as gym memberships. But $0 premium, really? How do they make money with a zero premium? Well, basically, there are three pieces to that formula. One piece is from a payment from the federal government. The insurance company that you sign up with receives a fairly sizable monthly payment for every person who is enrolled with them. Let's go ahead and use $12,000 a year as an example. If the payment to the plan is $12,000 a year, then the insurance company's challenge is to provide you with the required Medicare benefits for less than that amount so they can still make a profit. Here's how they try to do that. They form local and regional networks of hospitals and providers. Because of these networks, they receive discounted pricing for their members. If the members don't use these networks for their care, then the services may not be covered, and that would fall to the pocketbook of the member. Another way they try to generate a profit is they have significant copays when you access your health care. Now, I'm not talking about when you have an office visit, but I'm talking about when you have something pretty major. A knee replacement, a stroke, cancer, heart attack. These copays can be in the hundreds or even thousands of dollars. But through the use of these networks and copays and the payments from the federal government, the insurance company's goal is to deliver you the health care that you need and still make a profit. What are the advantages of Medicare Advantage? Typically, they have a low premium. They include prescription benefits, and they have some additional benefits like gym memberships. Now, this is my personal opinion. I don't think you should buy health insurance to get a gym membership. You should buy health insurance to protect yourself from the cost of getting sick. What are the trade-offs for Medicare Advantage? One, it's higher out of pocket if you don't use the networks. And you cannot just leave Medicare Advantage and revert back to the original Medicare program if you don't like how you're being cared for. You can only leave Medicare Advantage during the annual enrollment period, which is October 15th through December 7th. Your plan starts the following January 1st, and you are committed to that plan unless you move out of the plan area. Then you sometimes have what's called a special election period. Additional trade-offs would include that it's difficult to budget healthcare costs. Now, when are you going to get a serious illness? No one really knows. But when you do, you want really good insurance with no surprises. Now, my crystal ball is broken, and I expect yours is a little fuzzy as well. Also, the trade-offs, as we discussed, are the significant copays that can run into the hundreds and even thousands of dollars, which is why the final trade-off is MOOP, which stands for maximum out-of-pocket. That's how much a member can be responsible for in a given year. I have people tell me, yeah, but no one ever pays that. Trust me, if they have that maximum out-of-pocket, it's because some people not only pay that, but they could pay more. Now, when you retire, your life savings shouldn't be exposed to thousands of dollars of uncovered health care expenses. I'll bet that's not while you save that money. In summary, if you stay healthy, you'll probably like Medicare Advantage. And if you get really sick, you probably won't. The alternative to Medicare Advantage is Original Medicare. That's where you have parts A, B, and D. And then you would want a Medicare Supplement to pay for some of the expenses that the Medicare program holds you responsible for. Here's what you really need to know. If you have original Medicare and a supplement, you can go to any doctor or healthcare provider, hospital, or other facility that's enrolled in Medicare and accepting Medicare patients. How about prescription drugs? Are they covered? Typically no, unless you add drug coverage by joining a prescription drug plan, which is Part D. Do you need to choose a primary care doctor? No, you do not. Do you have to get a referral to see a specialist? In most cases, no, but the specialist must be enrolled in the Medicare program. And what about a supplemental policy? If you don't have employer or union coverage, you will want to buy a Medicare supplement if you're eligible. Of course, when you first become eligible for Part B of Medicare, you have an open enrollment to choose any Medicare supplement plan that you want. What else do you need to know about original Medicare? Well, generally you pay a set amount for your health care. There's a deductible that you know in advance before Medicare pays its share. You'll have to pay your monthly premium for Part B, but you're going to have to pay that for Medicare Advantage as well. And generally, you don't need to file Medicare claims as long as your provider has your supplemental carrier's information when they file the claim with Medicare. Then Medicare will electronically file that with your insurance company. This is a slide directly from the Medicare and You book. It says, every Medigap policy must follow federal and state laws designed to protect you, and it must be identified as Medicare Supplement insurance. This next slide may be the most important slide in the video. Different insurance companies may charge different premiums for the same exact policy. As you shop for a policy, be sure you're comparing the same policy. For example, Plan A from one company with Plan A from another company. I cannot stress this enough. The name of the insurance company that used to cover you for your group insurance, just because you're familiar with it, doesn't mean that that's really the best plan for you when you enter the Medicare program. We'll talk about that more in the next video. But the point to remember is, once you understand the benefits of the program that you like, you can compare that with any other company to find an identical plan. Then you can compare and find the one with the lowest premium. What are the advantages of original Medicare and a Medicare supplement? First, no network restrictions on doctors or hospitals. If you want to go to MD Anderson or the Mayo Clinic, you can go there. You can even go to your local doctor. How about that? It's easier to budget monthly premiums, the premium you pay for your insurance, then you know what your deductible is going to be. You're going to have fewer surprises. You just budget that amount in every month, and then you don't have to worry about getting stuck with hundreds or possibly thousands of dollars out of pocket. And that all leads to peace of mind. For those of you that feel more comfortable with original Medicare and a supplement, then the next video, I'll make a couple of recommendations that should make it easier for you to choose the plan that's best for you. I'll show you the way to find the lowest cost plan from all the top rated companies in your state, and you can get that rate in less than a minute. As always, if you have questions for me, you can call 800-465-3164. Add any comments below and let me know what you think about our videos. Also, click subscribe so you'll have access to all of the videos in our series. And finally, please share this video with anyone you know who could use this information. Thanks.